So on one of the dental forums, somebody asked how to increase your case acceptance with Invisalign or orthodontic treatment, as well as the second question was how to estimate treatment time for orthodontic or Invisalign cases. So let's tackle these two questions one at a time. So let's talk about the first part first, which is how to increase case acceptance, which is probably a 2 day seminar worth of information, but let's just try to summarize it here. So usually when we're talking about case acceptance, and I try to help doctors to increase the case acceptance for orthodontic cases, which is Invisalign, a form of orthodontic treatment, especially for GPs and pedodontists, I like to train the entire team to understand orthodontics and understand the benefits, and especially the emotional benefits to patients for providing orthodontic treatment or getting orthodontic treatment. Because just remember, people don't buy things or don't consent to treatment or don't get things because of some cognitive intelligent decision. Like people don't buy a convertible sports cars that's like $200,000 because it's gonna get them from point A to point B faster. No, they buy a sports car that's really slick because it makes them feel important, it makes them feel good, it makes them feel, socially, blending in with maybe the people they hang out with. So they buy it emotionally. They don't really think about it that, oh, a sports car is going to get me from here to Pittsburgh a lot faster. No, that's not how they buy things. They think like, okay, when I sit in my sports car, I feel a lot more confident. So use that information for your orthodontic case acceptance. So somebody with a beautiful smile, they're gonna feel more confident, just like the sports car. They're going to feel more socially accepted. A lot of times they have more friends. And one thing you notice too with people, when they fix up their smile and they have a nice straight smile, they also fix up their hair. They start dressing differently because they just feel more confident. So it's a lot easier for them to get jobs. And there's actually, by the way, research that shows this, that when you have a nice smile and you kind of take care of yourself and you dress well, you speak well, you basically make more money because you're more successful. So you want to talk to patients based on their emotional brain and not so much the cognitive brain. So don't go in there and tell them that oh, if you have braces and you straighten out your teeth, you reduce dental cavities or dental decay and gum disease. I don't care about that. They don't even floss a lot of times. So you need to talk to them somehow that it talks to their emotional brain, that it's going to increase their confidence. Sometimes even joke with people, oh, when you have a nice smile, you have to be careful, you might be engaged by tomorrow, or just make it kind of fun, but talk to them somehow more on an emotional level, not so much on a cognitive way. That's going to be the number one. Number two, and I always tell this to hygienists too, if you want to increase aesthetic procedures in your practice, just take a shade in your hygiene room. So when a patient sits in your chair, you could just get a color for their teeth, and you could say like, okay, this patient is A35, and just write it in a chart. And of course, the patient would ask, oh, what is A35? What is that? I said, well, that's just the shade of your teeth. And then you show them the guide. Okay, so this is we're going from A0 to A4. You just happen to be here, and then they the one who's gonna say like, ooh, that's actually kind of yellow. How do I get to A0? And then you can talk to them about like whitening veneers and etc. It's the same thing with orthodontics. So in your hygiene room, you could have the hygienist, for example, put down their class. You could say like, okay, patient is class 2, narrow arches, 10 millimeters of crowding. And the patient was like, well, what does all that mean? Well, what that means is that, you have some crowding, and that's why you have some chipped teeth, because they're hitting on top of each other. And also, you get some narrow arches, so that's why you have these dark areas when you smile that makes you look like you have missing teeth, but you don't, because a lot of people talk about that. I just had a recent post about it. When patients have narrow arches, they see these dark angles. Buccal corridors is the fancy name, when they smile. So when you expand their upper arch or you straighten up their teeth, they don't have those dark areas anymore, and they love their smile. I just posted about this on Facebook. So you can talk to patients in a hygiene room in a roundabout way. So what you do is you get their classifications. You say this patient is class 2, 10 millimeters of crowding, and a crossbite on the left side, and you classify every patient, which I think every dentist should do. That's how you're going to get a lot of patients interested in this. And you can try this with whitening. Starting Monday, get a shade on every patient that comes to your practice. So every patient, just tell them, when you're doing an exam, the hygienist gets a shade that, your teeth are A3 or your teeth are A35 or A4 or whatever. And the patients will ask when you're calling these out, well, what is that? Is that bad or is that good? I don't know. And then you can just show them the shade guide. It's not good or bad. It's just a color. So it's just whatever you like. So, the shades go from here to there, and you happen to be here. If you like to be, lighter, you could be here, and this is how you do it. So that will increase your case acceptance in a large way. Now, that's just getting people interested in the procedures. There's also a second part to this, which is case acceptance once you present it as. And just remember, people buy emotionally, so don't go in there with a lot of cognitive proof and evidence and stuff like that, like dental school. That's not going to get you anywhere. So once you get them interested and they are interested emotionally, now you have to get over three obstacles. And usually patients have three obstacles. One is pain. They want to know if a procedure is going to be painful or comfortable. So you want to do that. So you want to say, like, we do, for example, you could say that we use aligners. It's one of the most comfortable way of straightening your teeth. You're a good candidate for this. And most patients feel very low discomfort with this after the first 3 days. And the first 3 days, you can take some Advil or Tylenol, or usually ibuprofen is the best way. But this is a very comfortable procedure, and it's really good especially for adults, which tend to be more sore with braces. So then you bridge that. Number two is going to be cost. Patients are always worried about cost. So you can do like a payment option. That's the best. So you bridge that gap. So now you bridge the discomfort and the money. So you want to be real upfront about the insurance covers. You can pull up, the insurance information, as well as you can pull up, what the payment options are going to be. For example, you could offer zero interest financing, or whatever you do, but somehow make it so it's really easily understandable and it's really convenient for patients, and make sure that your financial options are very straightforward and very easy to understand. Otherwise, confusing. Just remember this: confused customers and confused patients don't buy and don't consent to treatment. So it's very important to know. So make it as straightforward as possible and very easily understandable. The third is going to be time, and it's especially a big deal for adults, which is going to be your office hours. Do you have convenient office hours, as well as how long is the treatment going to take? So, which is going to bring us to our next question. So we bridged the first part of the questions: how we increase case acceptance and how to deal with some of the objections that the patients have. And by the way, we cover this in our team training course. We have team training courses for doctors, how to train their staff to do this, as it's part of our mini residency program for GPs and periodontists. But to answer your question for how to determine how long a case will take, so this one is a little bit tougher because it comes with experience. Okay, so once you treat several cases, you're gonna have a better grasp of how long is the treatment take. Just in general, a comprehensive treatment with braces, that's a very difficult case. You're talking about like expansion, extractions, class 2 elastics, face mask, whatever. It's not an easy case. That usually takes somewhere between 18 to 24 months. If it's more like a relapse case, for example, they had braces before, so they actually class 1, and you just talk about straightening the teeth, and maybe they have rotations that's less than 10 degrees, and you're gonna use aligners for that, you're talking somewhere between 6 to 9 months. If you're talking about patients have some rotation, and that's with aligners. If you're talking about the patient have some rotations, but again, they class 2, it's more of a retreatment, and you're going to use braces for this, which GPs and periodontists should use braces. They should learn that, because that's the fastest way to and most predictable way of correcting a lot of these middle-line teeth. But if you're using braces, it will take somewhere between probably 4 to 5 months, maybe 6 at most. If you're using aligners, again, it's probably about 6 to 9 months. Now, if it's a more comprehensive case where they're not class 1, maybe they have 1 to 3 millimeter class 2 or 1 to 2 millimeter class 3, which over that you really shouldn't treat them probably with aligners, because things get a little tricky. So if they have like a 1 to 3 millimeter class 2, and they have some crowding, things like that, and you have to use some class 2 elastics and using aligners for this, I would probably shoot for somewhere around a year, because class 2 elastics is compliance dependent, so it should take time. I would probably not finance the payment plan for more than a year, because you also want the patients to have zero balance by the time you get done. So hopefully this answers your question. Check out our mini residency. We have an orthodontic mini residency where we cover all this, and we actually train your staff how to do this, because we have a staff training program. And actually, by the way, we're putting that class online. So starting this summer, the staff training program will be actually online, where you can train your entire staff. And we do this as part of our orthodontic mini residency, which already included with each of the doctors. So if you have any questions, feel free to reach out. But hopefully this helps. It's a big topic with the case acceptance, and like I said, make sure we're about the emotional brain, the heart, not so much the cognitive brain, and you will have a much better case acceptance and interest. And make sure you train your entire staff, and you're gonna have a lot better results with this. Okay, best of luck.